Have you ever caught a strange smell in the air and quietly wondered, is that me? It's not easy to talk about. But the truth is, body odor in older adults is far more common and far more misunderstood than people realize. This isn't about being lazy. It's not about forgetting to shower. In fact, many seniors are meticulous about their hygiene. Yet despite their best efforts, they still notice an unfamiliar scent clinging to their clothes, their sheets, or even their skin. And it can be embarrassing, frustrating, and isolating. So what's really going on? Doctors say that as we age, our bodies change in ways that can quietly sabotage even the best hygiene routines. Skin becomes thinner and more sensitive. Our sense of smell may fade. And habits that worked fine in our 40s or 50s might actually backfire in our 70s or 80s. In this video, we're uncovering 5 subtle hygiene mistakes that older adults often make. Mistakes that can lead to persistent, unpleasant body odor, even when you think you're doing everything right. These aren't dramatic failures. They're small, innocent oversights. But once you understand them, they're easy to fix. And the difference can be life-changing. So if you or someone you love has ever felt self-conscious about freshness or body odor, please stay with us. You deserve to feel clean, confident, and completely at ease in your own skin. And if you're watching this on our Life in Words channel, don't forget to hit the subscribe button and turn on the bell so you never miss an episode that helps you live healthier and happier every day. Let's dive in. Mistake number 1. Wearing the same clothes too long. Let's start with one of the most innocent mistakes that leads to the most surprising smells. Wearing the same clothes for too long. It sounds harmless, right? You slip on a shirt from yesterday. It looks fine. It doesn't feel dirty. And besides, you didn't sweat much, so why not wear it again? But here's the thing, body odor doesn't always come from dirt. It comes from bacteria. And that bacteria doesn't need a visibly stained shirt to grow. It just needs warmth, time, and your natural skin oils. This is especially true for clothes that sit close to your body, like underwear, socks, undershirts, and pajamas. These fabrics collect sweat and dead skin cells in areas that are warm and moist. And once those materials settle into the fabric, they become a buffet for bacteria. The longer they stay there, the stronger the smell becomes, even if you shower every day. Let me tell you about Harold. He's 77, lives on his own, and keeps a tidy routine. Every day, he sponge-bathed and rotated between the same few outfits. His house shirt and lounge pants, worn for 3-4 days in a row. He never noticed a thing. But when his daughter came to visit, she gently mentioned that his clothes had a musty smell. Harold was surprised. He thought, "But I wash myself every morning." The problem wasn't his hygiene, it was his laundry cycle. Once he started changing his clothes daily, especially underwear and socks, and added 1 extra laundry load per week, he noticed a huge difference. His clothes felt lighter. His home smelled fresher. And more importantly, he felt better in his own skin. So if you're still watching this and this tip rings true for you, drop a 1 in the comments to let us know. And remember, clean clothes don't just protect your body. They protect your confidence. Mistake number 2. Not cleaning and drying skin folds properly. Many older adults take great pride in their cleanliness. A warm shower in the morning, fresh clothes, a dab of lotion. These small routines offer a sense of comfort and dignity. But even the most well-meaning hygiene habits can overlook one critical detail: skin folds. As we age, our bodies naturally change. Weight fluctuations, loss of skin elasticity, and reduced muscle tone can create soft folds in areas like under the arms, beneath the breasts, around the belly, between the thighs, and even behind the knees. These places are warm, often moist, and, unfortunately, the perfect breeding ground for bacteria and yeast. The problem isn't that people skip bathing, it's that these areas can be difficult to see, reach, or remember. And when moisture gets trapped in a skin fold, it doesn't just create odor. It creates irritation, fungal infections, and painful rashes that can make even sitting or walking uncomfortable. Take Eleanor, for example. She's 80 and incredibly meticulous. Every morning, she showers, brushes her teeth, and puts on clean clothes. But her granddaughter noticed a faint, sour smell every time they hugged. One day, she gently asked, "Grandma, do you dry under your chest and belly after your shower?" Eleanor paused, surprised. "I usually let it air dry," she said. That one small change, using a soft towel to pat those folds dry, made the odor disappear in just a few days. It's a simple truth. What stays wet grows bacteria. So whether you use a towel, a handheld fan, or even a cool setting blow dryer, make sure those hard-to-reach spots are clean and dry. And avoid talcum powder or heavily scented sprays, which can trap moisture and irritate the skin. Treat every inch of your body with respect. And if this tip resonates with you, please comment the number 2 below so we know you're still with us. You deserve to feel fresh and comfortable from head to toe. Mistake number 3. Poor denture and oral hygiene. You could be spotless from head to toe, freshly showered and wearing clean clothes. But if your mouth isn't properly cared for, it can still be the main source of unpleasant odor. As we age, many of us transition from natural teeth to dentures or partials. And while that might seem like a simple change, it actually requires a completely new hygiene routine. Unlike natural teeth, dentures don't clean themselves with a quick rinse or a daily brush. They need specialized care. Dentures collect food particles, harbor bacteria, and can trap yeast in tiny crevices. When they're not thoroughly cleaned and not removed overnight, that buildup turns into a distinctive odor known as denture breath. It's dry, sour, and no amount of mints or mouthwash will mask it. Let me introduce you to Walter, 83, a kind and outgoing gentleman from Oregon. His friends at the senior center started keeping a bit of distance during conversations. He wasn't sure why. After all, he brushed his dentures every morning. But what he didn't do was take them out at night or soak them in cleanser. When his dentist finally examined him, he found signs of oral thrush, a fungal infection caused by bacteria thriving on poorly cleaned dentures. Walter was shocked. After switching to a gentle daily cleaning routine and soaking his dentures properly, the odor vanished, and so did the awkward distance from friends. Here's what you can do to avoid the same mistake. Brush dentures with a soft bristle brush and no toothpaste. It's too abrasive. Use denture-specific cleaners or mild dish soap. Soak them overnight in a proper solution. Let your gums rest while you sleep. Don't wear them 24/7. And don't forget your tongue, gums, and cheeks. A soft brush or tongue scraper goes a long way. Oral hygiene isn't just about fresh breath. Bacteria in the mouth can enter the bloodstream and raise your risk of heart disease, especially in older adults. If this was eye-opening for you, comment the number 3 below and tell us if you've ever dealt with something similar. Because a clean mouth leads to a confident smile, and that's something every person deserves. Mistake number 4. Skipping full showers or using too little water. Let's be honest, showering gets harder as we age. Whether it's joint pain, fear of slipping, or just the exhaustion of standing too long, many older adults start switching to sponge baths or quick rinses. And that's perfectly understandable. But over time, These shortcuts can quietly lead to persistent body odor. Here's why. Your skin needs more than just a wipe down to stay fresh. Every day, your body sheds dead skin cells, produces oils, and accumulates bacteria, especially in folds, creases, and less visible areas. Without a proper rinse, those things build up and begin to cause that faint, stale smell that clings even after a quick wash. Think about it like this. Would you wash your dishes with a damp cloth and skip the rinse? Of course not. The same goes for your body. Let me introduce you to Martha, 79, a retired librarian from Pennsylvania. After a hip replacement, she avoided the shower for safety reasons and relied on sponge baths. She cleaned diligently every day, but gradually noticed a greasy feeling on her skin and a lingering odor that didn't go away. Her physical therapist gently suggested a once-a-week full-body shower using warm water and a mild soap, with a safe setup. Grab bars, a sturdy shower chair, and non-slip mats. Martha gave it a try. The difference? Night and day. Her skin felt refreshed. Her clothes stayed cleaner longer. And, most importantly, she felt like herself again. If you're skipping showers due to mobility issues, remember, you don't have to do it alone. Ask a family member for help once a week or speak with a home care provider. And if a full shower still feels overwhelming, try using a handheld shower head while sitting safely. Every inch of your skin deserves attention and care. If you're still with us, leave a 4 in the comments to let us know. Because taking the time to rinse and refresh isn't a luxury. It's self-respect, and you deserve nothing less. Mistake number 5. Masking odor instead of fixing the cause. When most people notice an unpleasant smell on their body, in their clothes, or even in their home, the first instinct is to cover it up. A spritz of perfume, a puff of baby powder, a new deodorant with bold promises. But here's what doctors want you to know. Covering odor is not the same as eliminating it. In fact, masking it can make things worse. Artificial scents don't erase body odor, they mix with it. And when that happens, you often get a strange layered smell, something chemical, something musty, something that lingers in all the wrong ways. It's not subtle, it's not fresh, it's not you. This was exactly what happened to Leonard, 81, from Colorado. He grew up in a generation where cologne was a daily ritual. So when he noticed a lingering body smell, he doubled down, spraying more heavily each morning. But instead of solving the issue, the scent became overwhelming. His daughter finally said, "Dad, I love your cologne, but something's off." After some honest reflection, Leonard admitted that he'd been skipping showers in the evenings and relying on fragrance to freshen up. With a few small changes, returning to nightly rinses and using fragrance-free soap, the musty undertone disappeared. When he finally wore cologne again, it enhanced his presence, rather than hiding something. Here's the takeaway. Fragrance is a finishing touch, not a cleaning tool. Use it after you've bathed, on fresh skin and clean clothes, and be cautious with powders. Many can trap moisture in skin folds, increasing odor or causing irritation. Choose talc-free, hypoallergenic options if you must use them, and always apply with care. If you've ever reached for perfume before addressing the root cause, you're not alone. Drop a 5 in the comments if this mistake sounds familiar, and let's normalize talking about it. Because real freshness comes not from covering, but from caring. And you deserve to feel truly clean, from the inside out. Final thoughts. Cleanliness is confidence. So now that we've walked through these 5 common hygiene mistakes, each one subtle, easy to overlook, but completely fixable, take a moment to pause and reflect. Which of these felt familiar to you? Which one caught you by surprise? The truth is, smelling fresh isn't about covering up with products or doing what you've always done. It's about understanding how your body changes as you age and being kind enough to adjust with it. Maybe the clothes you rewear without thinking have started to hold odor. Maybe the areas you thought were clean are hiding moisture. Maybe your dentures, your shower habits, or your favorite fragrance need a second look. None of this means you're doing something wrong. It just means you're living in a body that's been through decades. And that body deserves compassion, attention, and respect. Because when you take the time to care for yourself, gently, intentionally, consistently, something beautiful happens. You don't just feel clean. You feel empowered. You feel proud. You walk taller. You smile more. And the world around you notices. If this video helped you today, share in the comments what you learned or what small change you plan to make this week. We read every message, and your words inspire others more than you know. And if you haven't already, please subscribe to our channel, Life in Words, and hit the bell so you never miss a new episode. Thank you for being here. Until next time, stay clean, stay confident, and stay kind to yourself. You've earned it.